It's a pleasure to present this on behalf of our group, and I should like to acknowledge that this is part of a joint symptoms and signs assessment of Detruza underactivity with Astellas. So, as you well know, Resnick described 30 years ago the concurrence of Detruza overactivity during filling and Detruza underactivity during voiding. So we wanted to look at this subgroup of patients. And Andrew Gammy, who's primarily responsible for this data, undertook a huge task to clean our urodynamic database to ensure that there was proper pressure and flow data and a proper filling phase in order to diagnose Detruza underactivity and Detruza overactivity. And you can see from the very large database that we've found 129 men who had Detruza underactivity alone and 123 who had the combination of DU and DO. We've also found female patients, but they're not the subject of today, although I'll mention it at the end. So here's the data from the men. Here in this column, Detruza underactivity alone and the combination, age, number of micturitions on the bladder diary, the volume at first desire to void, the volume voided during pressure flow studies, residual urine, and the maximum abdominal pressure during voiding. And you can see there are statistically significant differences in each of these measurements between the two groups. If we look at some symptoms, then urgency for fear of leakage, urgency incontinence, a history of going into urinary retention, and the urodynamic assessment of filling phase sensation also show differences. And these, we hope, will be signs, together with factors such as that described by Andrew Gammy in his earlier paper, that will give us a composite diagnosis of Detruza underactivity from non-pressure flow urodynamic studies. So the burden for men are the burdens you really might expect. So in some senses, this produces some face validation for our clinical concepts of the differences between people with Detruza underactivity alone and the combination. And you can see that men are older, as you might expect, because Detruza overactivity becomes more common with age. However, the figures are corrected for age. They pass smaller volumes, and they have increased frequency, as one might expect. They have less straining. We've also got the data, and I'll very quickly just show you the data on women, which is pretty similar. Again, lower volumes, more pad use, indicating probably urgency incontinence, but also some bowel problems, and similarly, less straining and shorter voiding periods if they have the combination. Thank you very much.
Thank you. The paper is open for discussion now.
Hi. What I think is crucial in what you're saying, and I share your observations, and my database is likewise, if I analyze that. What is crucial is the way how you do your dynamics. And the moment that you give the patient, especially the man, permission to void. And there's a lack of standardization here. And I think there exist two traditions. And the one is, if a contraction arises during filling phase, ask the patient to hold as long as he can, and then permit to void. So the system is on the emergency brake. And the other tradition might be that when you see the overactivity and you see the contraction again, and there's a normal urgency, allow the patient to void after that or during that contraction. That might have a dramatic effect on what you're measuring while establishing contractility during voiding. So my question is, what is your tradition? Are you asking the patient to hold as long as he can, or are you allowing the voiding while urgency arises with the second or third contraction during filling, or with the what we call the terminal Detruza overactivity? which is an omnibus.
Well, as you can imagine, we follow the good urodynamic practice
It's not
guidance
defined in the
from
good urodynamic
2002,
practice.
which is that our task is to reproduce the patient's symptoms. So
Yes.
that decision that you talk about is made during the urodynamics with the patient.
Yes.
If the patient is comfortable and able to continue to hold,
Yes.
then we ignore whatever the urodynamics is doing.
Sure.
And when the patient says, I really need to go now, we allow them to void.
Okay, so we share our tradition. Yeah.
Of course.
Yeah, good, good. I learned everything from you. But I think there are some situations or some clinics where the patient is asked to hold until the ears explode.
Yeah. No, I agree that's not good.
Okay, please.
Robert van Koeveringen from Maastricht, the Netherlands. Thank you very much for presenting this interesting study and interesting data. When looking at the number of patients that have detrusor overactivity and detrusor underactivity, it seems to be rather low. It's my impression from other databases that this might be higher. And then I come to my question, you looked at symptoms, did you also analyze overactive bladder symptoms and the association with the burden extra, or do you plan to do that? Now you look only at urodynamics, I understand, but if you are going to the definition of overactive bladder, do you expect more patients?
Well, in terms of course, these are a highly selected group. They're based on patients with detrusor underactivity. So in our whole male database, approximately 50% of men have detrusor overactivity. But of course, only a small proportion of those have detrusor underactivity, and that's the group you've seen. And indeed we did. I showed you a little bit of data at the end for urgency and urgency incontinence. And there was a highly statistically significant difference in the prevalence of urgency and urgency incontinence in those that had detrusor overactivity as well as detrusor underactivity.
Do you have an indication on the number of patients with detrusor underactivity on urodynamics that have overactive bladder symptoms?
Yes, well, I'm sorry, the precise data figures. No, I don't have those to hand.
Thank you.
Okay. Last question, please.
Letitia de Kort from the Netherlands. What's your opinion on the cause of the role of bladder outlet obstruction in men with a combination of detrusor underactivity and overactivity, and do you have any data on that?
Well, I have an opinion, and the opinion that all these phenomena are related to age, and probably very little related to obstruction. And the reason I say that, particularly if you take detrusor overactivity and overactive bladder, if you plot the prevalence of those conditions, they are identical in men and women. And of course the women are not obstructed. A tiny proportion of the women are obstructed. And I think the same probably goes for detrusor underactivity. So we would generally make the assumption that these are separate conditions, and indeed we've done some work, as you probably know, on the combination of detrusor underactivity and bladder outlet obstruction. So in an aging population particularly, we're increasingly going to see the combinations of bladder outlet obstruction, detrusor underactivity during voiding, and detrusor overactivity during filling. And we have to work out how to deal with these, both from the urodynamic point of view, in terms of diagnosis, and of course, more importantly, how we deal with them clinically.